Good morning. It's November 3rd, Friday, 2023, and this is the Diabetes Recovery Channel, YouTube channel. Welcome. My name is Kevin, and we're going to talk about diabetes today. Welcome for being here. The mission of the Diabetes Recovery YouTube channel is to recover people from diabetes, is to give them information so that they can recover, cure, and get over diabetes. The vision is a world free of diabetes and diabetes complications, and we are going to explore and share much information about that to everybody that wants to learn how to recover from diabetes. We founded this channel to improve the lives of people with diabetes and provide diabetics with the tools to navigate the world of diabetes. Come learn about diabetic diet, health myths, nutrition, diabetes control tips, high blood sugar regulation, controlling fasting blood sugars, and general wellness. We believe that diabetes can be reversed, cured, and people can recover from diabetes. We will share stories of diabetes recovery and promising research. Thank you for being here. Today is November 3rd, 2023, Friday, and welcome to the Diabetes Recovery Channel. We're going to talk a lot about what scientists have discovered, upcoming research, and we're going to dispel myths about diabetes. Diabetes misconceptions, facts. Some believe that all diabetics need insulin and injections. That's not true. Not all diabetics require insulin therapy. Diabetes, also called diabetes mellitus, is a condition that affects insulin. Insulin is a hormone that breaks down sugars in the food that you eat and converts them into glucose to fuel the body. There are three types of diabetes: type 1 diabetes, type 2, and gestational diabetes. Type 2 is the most common, and cases of both type 1 and type 2 are on the rise. We're going to talk about why we think that is so also. Diabetes is diagnosed in one or more blood tests. Diabetes may be managed with monitoring, medication, diet, and lifestyle changes. But we also believe it can be reversed. And we're going to show you research how it has been reversed in several people. Diabetes occurs when the body does not process food as energy properly. Insulin is a crucial hormone that gets glucose, in other words, sugar that is used as energy, to the cells in your body. When you have diabetes, your body doesn't respond to insulin or doesn't produce insulin at all. This causes sugar to build up in your blood, which puts you at risk for dangerous complications. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the cells in the body that produce insulin. The rate of type 1 diabetes is rising in the world, and the greatest increase occurs in children younger than 5 years of age. In people with type 1 diabetes, the body does not make enough of the hormone insulin, which enables the body to convert glucose into energy. Type 1 diabetes develops when the insulin-producing beta cells, we're going to talk a lot about the beta cells in the pancreas, are destroyed due to an autoimmune process in which the body's immune system mistakenly destroys its own organs or tissues. The onset of symptoms can happen quickly. People with type 1 diabetes may need daily insulin shots. Stress and blood sugar, fact. Stress, some people believe that stress has no impact on blood sugars, but stress can cause blood sugar spikes. Some people believe or have been told that carbs are the enemy for diabetes. That's not true. Healthy carbs are essential. for energy for the body. Now, type 2 diabetes, which is different from type 1 diabetes. Type 2 diabetes is a metabolic disorder that results from the body's inability to make enough insulin or to properly use it. Type 2 diabetes is the most common diabetes in the world. In type 2 diabetes, the pancreas produces enough insulin, but the body cannot use it effectively. This is referred to as insulin resistance. The body is resistant to the insulin. Gradually, insulin production slows down, and as in the case in type 1 diabetes, previously unheard of in children and teens, but type 2 diabetes is now being diagnosed more often in children and teens, which some research links to increasing rates of childhood obesity. You know, actually, I've seen stories too that raccoons in New York are starting to get diabetes. But these are raccoons that eat out of the garbage cans, they're eating pizza, fast food, and we know that that is the cause of their diabetes. And they're also becoming obese also. So what people eat has a great effect on diabetes. Gestational diabetes develops during pregnancy when a hormone made by the placenta prevents the mother's body from using insulin effectively. It is not caused by lack of insulin, but by other hormones produced during pregnancy that can make insulin less effective. Gestational diabetic symptoms disappear after delivery of the baby, which is good news. Now, diabetes and eye health fact. Diabetes, some people believe that diabetes doesn't affect the eyes. Not true. High blood sugar can lead to diabetic retinopathy. So diabetes does affect the eyes. We're going to switch reports here, and we're going to go over to the earthquake report. 5 hours ago, there was a 1.9 magnitude earthquake in central Alaska. Just 5 hours ago. There were no reports from the public. This was today, Friday, November 3rd at 10:26 a.m. Pacific time. There was no damage to property, but this is a 1.9 magnitude earthquake. Looking at the big picture of diabetes, there's more than 37 million people in the United States that have diabetes, and 1 in 5 do not know that they have it. That's amazing. 96 million U.S. adults, which is over a third of the population, have pre-diabetes, and more than 8 out of 10 don't know that they have it. Diabetes is the 8th leading cause of death in the United States. However, it may be underreported. Type 2 diabetes accounts for approximately 90 to 95% of all diagnosed cases of diabetes. Type 1 diabetes accounts for approximately 5 to 10%. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled as the American population has aged and become more overweight and obese. Now let's talk about sugar craving and diabetes. There's a myth that diabetics never crave sugar treats. However, managing cravings is the common challenge. The cost of diabetes. Medical costs and lost work and wages for people diagnosed with diabetes has totaled $3.7 billion yearly. Medical costs for people with diabetes are twice as high as for people who don't have diabetes. Oh, just 3 hours ago, there was an earthquake, 1.8 magnitude in Pahala, Hawaii, at a depth of 29 meters. There were no reports from the public, and this was recorded at Friday, November 3rd, 2023. And no damage to property. Let's talk about pre-diabetes. Pre-diabetes is a condition where blood sugar is elevated, but not to the degree that it constitutes diabetes. People who have repeated tests showing elevated fasting glucose have an increased risk of developing full-blown diabetes. Those over the age of 45 should be tested for pre-diabetes or diabetes. If a first blood glucose test is normal, individuals should be retested every 3 years. That's the recommendation. Those under the age of 45 should consider testing for pre-diabetes or diabetes if they have a body mass index or a BMI greater than or equal to 25 kilograms per mass and have several risk factors, such as a sedentary lifestyle, taking certain medications, including antipsychotic, steroids, diuretics, or having a family history of the disease. Talking about new research, there is a myth that there's no such thing as an artificial pancreas. However, advanced technology today has helped manage blood sugar. Diabetes and pregnancy. During pregnancy, diabetes must be managed carefully. It is crucial to manage diabetes during pregnancy. Hyperglycemia. Hyperglycemia is high blood sugar. Diabetes is characterized by a failure to excrete enough insulin. Insulin is a hormone produced in the pancreas. It is needed by the body to convert glucose, of course, into energy. And without adequate insulin, abnormally high levels of glucose accumulate in the blood. On the other side of the coin is hypoglycemia, or low blood sugar. Hypoglycemia is characterized by a blood sugar level that is too low for the body's normal functioning. Hypoglycemia may be a condition by itself, or a complication of diabetes, or a sign of another disorder. Problems with blood sugar regulation due to diabetes can occur, such as headaches, increased thirst, frequent urination, increased appetite, weight loss, blurred vision, fatigue, dry mouth. And of course, if you or your child develops any of these symptoms, consult a physician immediately. Special note, even though type 1 diabetes may take years to develop, the onset of symptoms is fairly sudden and rapid. Undiagnosed and untreated, a person with type 1 diabetes can go into a life-threatening diabetic coma. Symptoms of type 2 diabetes are the same as the symptoms of type 1 diabetes. But unlike type 1 diabetes, symptoms tend to develop slowly and gradually. So the myth that smoking does not worsen diabetes, when in fact smoking increases diabetes complications and their risk, just like the other symptoms that we mentioned. So diabetes can be diagnosed with one of the more following blood tests. A random blood sugar test taken at any time, regardless of how recently you have eaten. It's important to do that. An A1C test assesses blood sugar levels over several months. Then there's the fasting blood sugar test. Measures blood sugar levels after a person has not eaten overnight. The next is the glucose tolerance test. This takes blood levels over the course of several hours to slowly see how quickly your body metabolizes the glucose in a special liquid that the patient drinks. Diabetes treatment. Treatment for diabetes depends on the type and severity and may include frequent blood glucose checking to monitor blood glucose levels. It also involves lifestyle changes. We're going to be talking a lot about that. And the research that even goes back to 1916 that shows that lifestyle and fasting can have a positive effect and actually can help people to recover from diabetes. This information's been around for a long time. Lifestyle changes include diet and exercise. It also may include oral medication, and in the extreme, may involve daily insulin injections. However, regular physical exams are crucial for people with any type of diabetes to monitor and treat any arising complications, such as, of course, eye problems, kidney disease, cardiovascular disease, neuropathy, which is damage to the nerves. Some people think that taking metformin is a cure, but that's not true. It's actually a medication to manage blood sugar levels. So even though a patient is taking metformin, that alone will not reverse diabetes. So glucose is an important source of energy for the cells of the body that make up muscles and tissues. Of course, it's also the brain's main source of fuel. Looking over here at the earthquake report, we have 3 hours. There was an earthquake in Fiji. There were no reports from the public. Amazing. It was a 5.3 magnitude earthquake. And so far, no property damage reported. Other symptoms of type 1 and type 2 diabetes are presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. So your body is looking for energy, it's looking for sugar. And when it doesn't get it, then it breaks down muscles and tissue, which produces ketones. Ketones is a byproduct, and people breathe it out, and you can smell it. Another symptom is feeling irritable or having other mood changes, having blurry vision, slow healing sores, getting lots of infections, such as gum infections, skin infections. So type 1 diabetes can start at any age. Insulin works as a hormone that comes from a gland behind and below the stomach, which is called the pancreas. The pancreas releases insulin to the bloodstream. The insulin circulates, letting sugar enter the cells of the body. Insulin lowers the amount of sugar in the bloodstream, and as the blood sugar levels drop, so does the secretion of insulin from the pancreas. So it's important to have a healthy pancreas. It's important to have a healthy metabolic system. It's not well known that diabetes affects the heart. Diabetes is a major risk factor for heart disease. We're going to talk about many other organs that diabetes affects, because this is the Diabetes Recovery Channel. Our mission is to help people recover from diabetes, and our vision is to have a world without diabetes and diabetes complications. We're going to provide information to people that are diabetic to help navigate the world of diabetes. We're going to talk about diabetes diet, health myths, nutrition for diabetics, diabetes control tips, high blood sugar regulation, controlling fasting blood sugars, and general wellness. This is the Diabetes Recovery Channel on Friday, November 3rd, 2023. And my name is Kevin. Our mission here is to prevent and cure diabetes. And we're going to talk about a lot of research that even goes back to 1916 that showed that fasting does reverse diabetes permanently. So we're going to answer the question, is type 2 diabetes reversible? You know, medical doctors have been trained that diabetes is a chronic and progressive disease, but that is simply not true. Stick around on this channel and you will learn about research that goes back to 1916. From Dr. Elliot Jocelyn, who showed that fasting does help diabetics recover from diabetes. The risk factors for diabetes depends on the type of diabetes. Family history may play a part in all types of diabetes, but we believe that environmental factors have a higher ability to create diabetes in people. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes. Immune system cells and autoantibodies. If a person has these autoantibodies, then they have an increased risk for developing type 1 diabetes. But not everyone who has these autoantibodies develops diabetes. Pre-diabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight or obese. The long-term complications develop gradually. The longer the person has diabetes, the less control they have over their blood sugar, and the higher the risk of complications. You know, people start out taking one pill, then they later 2 pills, then 3 pills, then 4 pills, and then finally end up on insulin injections. So it's important to learn how you can possibly reverse your diabetes and get off all medications. That's why this is a diabetes recovery channel. Possible complications of diabetes are heart and blood level disease, cardiovascular disease. Diabetes mortally increases the risk of many heart problems. These can include coronary artery disease with chest pain, heart attack, stroke, and narrowing of arteries, which is osteoporosis. If you have diabetes, you're more likely to have a heart attack or stroke. Also, another complication from diabetes is nerve damage. Too much sugar can injure the walls of the tiny blood vessels, or what we call capillaries, that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers. You know, one of the first things that doctors noticed was with bariatric surgery, very, very quickly reverse type 2 diabetes. Of course, bariatric surgery is involving cutting out pieces of the stomach and making it very small, or also rewiring the intestines so that food does not get absorbed as much. So studies showed that immediately after surgery, that type 2 diabetes was reversed almost immediately, within weeks. And that's also before much weight was lost. There was another earthquake 4 hours ago of 1.6 magnitude in Loving, New Mexico. Doesn't sound like any property damage was reported. But yesterday there was a 6.1 magnitude earthquake in Indonesia. There were reports from 8 people. This was Wednesday, actually, November 1st, 2023, at 21:08 p.m. I don't see any reports of damage, property damage. Other studies have showed, even with randomized control trials, showed the same thing, that a person showed that a person who was treated, who had diabetes and was treated with medications, they would have to continue taking their medications and their diabetes never got better. But when they got weight loss surgery, they were able to lose weight, and when they lost that weight, they were able to get off their medications, and their blood sugars also normalized. We're going to talk a lot about this type of research, these type of findings on the current channel you're on, the Diabetes Recovery YouTube channel. Today is Friday, November 3rd, 2023, and my name is Kevin. So nerve damage from diabetes. Too much sugar can injure the walls of the tiny blood vessels, and damage to the nerves related to digestion can also cause problems with such as vomiting, nausea, diarrhea, or constipation. Now let's talk about the kidneys. Kidneys hold millions of tiny blood vessel clusters that filter waste from the blood, and diabetes can damage this intricate filtering system in the body. The other complication from diabetes is retinopathy, or eye damage. Diabetes can damage the blood vessels of the eyes, and this can lead to blindness. We sure don't want that to happen to you. Everybody knows or has heard about foot problems from having diabetes. Nerve damage in the feet or poor blood circulation to the feet increases the risk of many foot complications. So you've probably heard about people with diabetes getting their toes amputated, their feet amputated, because there is low blood flow to the feet and the toes. Another complication is skin and mouth conditions. Diabetes may leave a person more prone to skin problems, including bacterial and fungal infections. Another complication of diabetes is hearing problems. Hearing problems are more common in people with diabetes. Another complication is Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Another common problem is depression. Since diabetes is really hard to control, takes a lot of energy, and is draining on the emotional system, depression symptoms are common in people with type 2 and type 1 diabetes. So it's important to have good mental health and a good support system. There are also complications of gestational diabetes. What people don't realize also is that diabetes impacts oral health, gum disease, and tooth problems are common with diabetics. Another myth is that people believe that only people with diabetes need to test their blood sugar, but regular blood sugar testing helps with early detection. Helps to detect the people that are in pre-diabetes and can help them to reverse their diabetes. Gestational diabetes. Most women who have gestational diabetes deliver healthy babies, which is good. However, untreated or uncontrolled blood sugar levels can cause problems for the mother and the baby. Complications, the problems that can be caused by gestational diabetes include excessive growth. Extra glucose can cross the placenta. Extra glucose triggers the baby's pancreas to make extra insulin. This can cause the baby to grow too large, or it could lead to a difficult birth and sometimes the need for a C-section. Other complications with gestational diabetes are low blood sugar. Sometimes the babies born from mothers with gestational diabetes develop low blood sugar, which is hypoglycemia, shortly after birth. This is because their own insulin production is high. Or it can cause type 2 diabetes later in life. Babies of mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. And to the extreme, one of the complications could be death. Untreated gestational diabetes can lead to a baby's death, either shortly before or shortly after birth. Complications for the mother by gestational diabetes include symptoms of preeclampsia, which include high blood pressure, too much protein in the urine, or swelling in the legs and feet. The other complication in the mother is that she could be diagnosed with gestational diabetes again. If she's had gestational diabetes in one pregnancy, she's more likely to have it again in the next pregnancy. Another myth with diabetes is that people believe that sugar in all fruits is just as bad as candy. That's not true. There are natural sugars in some fruits that will help benefit diabetes. We're going to talk about that and tell you which fruits are better for you because they slowly release sugars in the body. Looking at the earthquake report, there was a 2.0 magnitude earthquake at a depth of 7 kilometers in Menton, Texas, United States. Didn't sound like there was any property damage there. Now, diabetes prevention. Type 1 diabetes can be prevented. Checking my settings here. Type 1 diabetes can be prevented, but healthy lifestyle choices that help to treat pre-diabetes, type 2 diabetes, and gestational diabetes can also help prevent them. Of course, eating healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits that release sugars slowly, vegetables, and whole grains. It's important to eat a variety to keep from feeling bored with what you eat. There's a common misconception that diabetes does not affect kidneys. However, kidney disease is a common complication of diabetes. As far as preventing diabetes, it's important to get physical activity. The recommendation is try to get 30 minutes of moderate aerobic activity on most days of the week, or aim to get at least 150 minutes of moderate aerobic activity in a week. For example, take a brisk daily walk, or if you can't get in a long workout, break it up into smaller sessions throughout the day. Of course, I think this is pretty well known. Lose excess pounds. If the patient is overweight, losing even 7% of your body weight can lower the risk of diabetes. For example, if you weigh 200 pounds, losing 14 pounds can lower the risk of diabetes. Very interesting. Of course, if you're pregnant, don't try to lose weight during pregnancy. And most important, talk to your medical provider about how much weight is healthy for you to gain during pregnancy. It's important to keep your weight in a healthy range. Work on long-term changes to eating and exercise habits. It's not just diet for 1 or 2 days. Of course, remember the benefits of losing weight, such as a healthier heart, more energy, and a higher self-esteem. Sometimes drugs are an option. Oral diabetic drugs, such as metformin, may lower the risk of type 2 diabetes, but healthy lifestyle choices are important. If you are a person that has prediabetes, have your blood sugar checked at least once a year to make sure you haven't developed type 2 diabetes. Many people don't realize how much stress has an impact on diabetes. So it's important to learn to cope with stress. Oh, looking at the earthquake report 5 or 6 hours ago, there was a 4.9 magnitude earthquake in the ocean at the mid-Atlantic range. And there were no reports from the public. And of course, since it's out in the middle of the ocean, there was no property damage. Let's talk about prediabetes. If you are a person that has prediabetes, you have a higher than normal blood sugar level. Yet, it's not considered to be type 2 diabetes yet. But without lifestyle changes, adults and children with prediabetes are at risk to developing type 2 diabetes. It's important to see your doctor. If you are a person who has prediabetes, long-term damage of diabetes, specifically to your heart, blood vessels, and kidneys, may already be starting. But the good news is that progression from prediabetes to type 2 diabetes is not inevitable. Eating healthy foods, making physical activity a part of your daily routine, and staying at a healthy weight can bring blood sugar levels down back to normal. Same lifestyle changes that can help prevent type 2 diabetes in adults might also help bring children's blood sugar levels back to normal. That's good news. Another myth is some people believe that type 1 diabetics are always insulin sensitive. The fact is, type 1 diabetics can develop insulin resistance. And that's why you're on this channel today called Diabetes Recovery with Kevin on Friday, November 3rd, 2023. Another myth out there is that diabetics cannot enjoy a drink with friends. However, responsible alcohol consumption is possible. Symptoms of pre-diabetes include, actually, the fact is, pre-diabetics don't usually have any symptoms or signs of diabetes. One possible sign of pre-diabetes is darkening skin on certain parts of the body. Now, the affected areas can include the neck, armpits, and groin. Classic signs of symptoms that suggest that a person has moved from pre-diabetes to type 2 diabetes include increased risks, increased thirst, frequent urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, frequent infections, slow healing sores, unintended weight loss. So you might be wondering, when do you see your doctor? See your doctor, your healthcare provider, if you're concerned about diabetes or if you notice any of the type 2 diabetes signs and symptoms. Ask your healthcare provider about blood sugar screening if you have any of the risk factors for diabetes. Causes. The exact cause of prediabetes is unknown, but family history and genetics may play an important role. What we do know is that people with prediabetes don't process sugar, or what we call glucose, properly. Most of the glucose in the body comes from the food you eat. When food is digested, sugar enters the bloodstream. Insulin allows sugar to enter your cells and lowers the amount of sugar in your blood. Insulin is produced by a gland located behind the stomach called the pancreas. Your pancreas sends insulin to your blood when you eat. When your blood sugar level starts to drop, the pancreas slows down the secretion of insulin into the blood. When a person has prediabetes, this process doesn't work as well. As a result, instead of fueling your cells, sugar builds up in your bloodstream. And you know what? This can happen because your pancreas may not make enough insulin, or your cells become insulin resistant to insulin and don't allow much sugar inside your cells. Some of the factors that increase the odds of getting type 2 diabetes or increase the risk of prediabetes include weight. Being overweight is a primary factor for prediabetes. The more fatty tissue a person has, especially inside and between the muscle and skin, around the abdomen, or around the organs, the more resistant your cells become to insulin. Another myth that there's a myth out there that diabetics should only eat fat-free foods. However, healthy foods are essential for a balanced diet. It's important to have a balanced diet. But we're going to also talk about keto diet. We're going to talk about low carb diet too on this channel called Diabetes Recovery. Another myth is that type 2 diabetes is caused solely by obesity. That's not true. Totally true. Genetics and lifestyle both play a significant role in being diagnosed with type 2 diabetes. Wow, looking at the earthquake report, there are several earthquakes in Texas. Another one 6 hours ago with a magnitude of 1.7 at 6 kilometers deep at Mentone, Texas, United States. There was another earthquake 6 hours ago, which was a 2.1 magnitude at 47 kilometers deep in Homer, Alaska. .1 magnitude earthquake, 47 kilometers from Homer, Alaska. Friday, November 3rd, 2023. There were no reports from the public. And looks like no property damage. Just recently, 18 minutes ago, there was a report of a 4.8 magnitude earthquake south of Fiji Islands. This is at a depth of 535 kilometers deep. Back to pre-diabetes. Looking at weight size, a large waist size can indicate insulin resistance. The risk of insulin resistance goes up for men with waist larger than 40 inches, and for women with waist larger than 35 inches. Of course, another risk factor is diet. Interesting enough, eating red meat and processed meat and drinking sugar-sweetened beverages is associated with a higher risk of pre-diabetes. We're going to talk about a case of a man in the United States who was a real estate agent, and he drank a lot of high-energy drinks, fast food, and when he went to his doctor, he was put on a low-carb diet, high meat diet actually, and he reversed his diabetes. So stay tuned to that story. Another risk factor is inactivity. The less active a person is, the greater risk of obtaining prediabetes. Age. Although diabetes can develop at any age, the risk of prediabetes increases after age 35. Of course, family history. The risk of prediabetes increases if you have a parent or a sibling with type 2 diabetes. Another risk factor is gestational diabetes. If a mother had diabetes while pregnant, which is called gestational diabetes, the mother and her child are at higher risk of developing prediabetes. Another risk factor is sleep. People with obstructive sleep apnea, a condition that disrupts sleep repeatedly, have an increased risk of insulin resistance. And of course, people who are overweight or obese have a higher risk of developing obstructive sleep apnea. So the two go together. Tobacco smoking. Smoking may increase insulin resistance and increase the risk of type 2 diabetes in people with pre-diabetes. Smoking also increases the risk of complications from diabetes. So if you have diabetes, it's important not to smoke. One thing that people don't realize is how diabetes affects travel. So traveling increases complications to the lack of exercise, the change in eating styles. So it's important to have proper planning when a diabetic is going to travel. They have to think about where they're going to exercise, where they're going to get activity, where they're going to eat. And there's a misconception or a myth about nerve damage. Some people believe that diabetes does not lead to nerve damage. However, neuropathy is a common complication of diabetes. Turning to the earthquake report, 4 hours ago, there was an earthquake at Anchor Point, Alaska, a magnitude of 1.6. Six hours ago, there was a 2.1 magnitude earthquake in Baja California, Mexico, at the Delta. .1 magnitude earthquake, 8 kilometers from Delta in Baja, Mexico, just south of Mexicali. There was no report from people, and we don't know whether there was any property damage. Like I said, smoking increases the risk of complications from diabetics. Other conditions associated with increased risks of pre-diabetes include high blood pressure, low levels of high-density lipoprotein. They call this HDLs, or cholesterol, the good cholesterol. These are other conditions associated with the risk of prediabetes. Or high levels of triglycerides, which is a type of fat in the bloodstream. Talking about metabolic syndrome, when certain conditions occur with obesity, they're associated with insulin resistance. It can increase a person's risk for diabetes and heart disease and stroke. A combination of 3 or more of these following conditions is often called metabolic syndrome. These conditions include high blood pressure, low levels of HDL, high triglycerides, high blood sugar levels, and large waist size. Complications of prediabetes have been linked with long-term damage. They include heart problems, blood vessels problems, kidney problems, and this is even if the person has not progressed to type 2 diabetes. Prediabetes is also linked to silent or unrecognized heart attacks. Prediabetes can progress to type 2B diabetes, which leads to high blood sugar, high blood pressure, high cholesterol, heart disease, stroke, kidney disease, liver damage, fatty liver damage, eye damage and loss of vision, and of course, amputations. Another misconception or myth out there is that sugar does not affect your mood. Of course, to the contrary, sugar crashes can lead to mood swings. Getting support is important. Some people believe that they have to hide their diabetes from others. But a strong support system is necessary and can help the person manage it. Regarding prediabetes, healthy lifestyle choices can help a person prevent prediabetes and its progression to type 2 diabetes, even if diabetes runs in your family. Prevention includes eating healthy foods, getting active, losing excess weight, controlling blood pressure and cholesterol, and if you're smoking, to quit smoking. Another misconception about diabetes is that some people believe that diabetes does not affect the immune system. However, to the contrary, diabetics are more prone to infections and slower recovery from injury. So it's important to take care of your immune system if you have diabetes. The American Diabetes Association, or the ADA, recommends that diabetes screening for most adults beginning at the age of 35. The American Diabetes Association advises diabetes screening before the age of 35 if you're overweight and have additional risk factors for prediabetes or type 2 diabetes. If you have gestational diabetes, your healthcare provider will likely check your blood sugar levels at least once every 3 years, maybe sooner. So, let's talk about A1C test. This test indicates your average blood sugar level for the past 2 to 3 months. In general, a level below 5.7 is normal. Between 5.7 and 6.4 is diagnosed as pre-diabetes. A level of 6.5 or higher on 2 separate tests indicates diabetes. That's your A1C level. However, certain conditions can make your AC1 level test inaccurate, such as if you're pregnant or have an uncommon form of hemoglobin. Next is the fasting sugar test. A blood sample is taken after you've eaten. You have not eaten for at least 8 hours or overnight. This is called fasting. Blood sugar values are expressed in milligrams of sugar per deciliter, or mg/dl. So a level less than 100 mg/dL is normal. 100 to 125 is diagnosed as pre-diabetes, and 126 or higher on two separate tests is diagnosed as diabetes. This is the Diabetes Recovery Channel. My name is Kevin, and it's Friday, November 3rd, 2023. The oral glucose tolerance test is less commonly used than the others, except during pregnancy. The patient will need to fast overnight and then drink a sugary liquid at the primary care provider's office or the lab testing site. Blood sugar levels are tested periodically for the next 2 hours. In general, a level of 140 is normal. A level of 140 to 199 is consistent with pre-diabetes, and a level of 200 or higher after 2 hours suggests the diagnosis of diabetes. If you have pre-diabetes, your physician, healthcare provider will typically check your blood sugar levels at least once a year. Now let's talk about emotional eating. Emotional eating, there's a myth that emotional eating isn't common in diabetics. However, emotional eating does affect blood sugar levels, and emotional eating is very likely to be with diabetics. Another myth is that diabetes doesn't cause vision problems. However, regular eye checks are essential for diabetics. Children and pre-diabetes screening. Type 2 diabetes is becoming more common in children and adolescents, likely due to the rise in obesity. The American Diabetes Association recommends pre-diabetes testing for children who are overweight or obese or have one or more of the following risk factors for type 2 diabetes. That is, a family history of type 2 diabetes, being of a race or ethnicity associated with increased risk of diabetes, low birth weight, being born to a mother who had gestational diabetes. We talked about that before. Another myth about diabetes is that a sugary cereal is the perfect breakfast. Wrong. High fiber, protein-rich breakfast stabilizes blood sugar. Checking your earthquake report. 6 hours ago, we had a 2.7 magnitude earthquake at 3 kilometers depth at Andrew, Texas. Andrew, Texas had 2 earthquakes in the past 24 hours, 5 earthquakes in the past 7 days, and 12 earthquakes in the past 30 days. Shockingly, they've had 207 earthquakes in the past 365 days. I wonder what's going on over there. Bet it's a lot of fracking. Seems to be a lot of earthquakes in the world. So the range of blood sugar levels that are considered normal, that are considered pre-diabetes and diabetic are the same for children and adults, remarkably. Children who have pre-diabetes should be tested annually for type 2 diabetes, or more often if the child experiences a change in weight or develops signs or symptoms of diabetes, such as increased thirst, increased urination, fatigue, or blurred vision. Sure to take care of those signs and symptoms. Another diabetes myth is that diabetics can only eat bland snacks while traveling. However, healthy snacks can keep blood sugar stable. Checking our technology here. We're doing fine. And I want to thank you for coming to the Diabetes Recovery YouTube channel. My name is Kevin. It is November 3rd, 2023. And that concludes this recording. We will have much more information, much more research, much more success stories about diabetes recovery. And our mission is to provide information to diabetics about diabetic recovery from diabetes. Some of this research goes back to 1916, which we will share with you. And we will share many success stories, many facts about nutrition, recovery from diabetes. And our mission here is to have a world without diabetes and diabetes complications. Thank you for being here. Thank you for watching this video, and have a great day. Be sure to hit the like button, hit the subscribe button, and make comments down below. Thank you very much for being here.